The government has tasked local NHS services with creating a new care setting, community diagnostic centres, to bring a range of diagnostic services closer to where people live and work to ultimately improve patient outcomes. These local areas have to consider 3 key elements to establish their centres: facilities, buildings, equipment; workforce, radiographers, doctors, nurses; connectivity, systems, technology. There are many challenges with establishing these elements effectively. From clear lines of accountability for patients at each stage of the pathway, to data management and ownership, clinicians' use of their own mobile devices, and trying to adapt existing inflexible IT infrastructures in what is effectively a new care setting in the centres. With our 20-year experience in medical imaging and clinical communications, Bleeper can play a key role in connecting the centres with other care providers. With the right digital infrastructure, community diagnostic centres can transform the way they deliver care to patients. Here is an example of how Bleeper can improve the care pathway for patients and clinicians alike. Alice visits her GP with a shortness of breath. The GP makes a referral through their existing system, which is then picked up by Bleeper, creating a Bleeper episode for the patient. Alice is then referred to the local diagnostic centre on the high street near where she lives for tests. The GP refers Alice to the local diagnostic centre for an ECG, echo, X-ray and blood test, using Bleeper or their existing referral tool. Because Bleeper connects the systems used by all the different care settings involved in Alice's care, all the information, including the diagnostic scans, reports, referrals and appointments, the process is all in one place, accessible to the whole clinical team. Alice goes to the diagnostic centre to have her scan. The requested tests are reviewed with a duty clinician through Bleeper to ensure that they do the right investigations first time, reducing the reinvestigation rate. To increase capacity, the diagnostic centre outsources some radiology reporting to an external provider. Bleeper ensures that the external company feels like an extension of the diagnostic team by integrating with their systems and ensuring the clinical discussion is captured and shared. The external radiologist reviews the results and refers Alice to a cardiologist at the local hospital. The radiologist writes their report and adds it to the Community Diagnostic Centre system. The report and imaging is automatically uploaded into Bleeper. Alice's GP is alerted via Bleeper that this information has been added and she can review it within the platform. If she has any questions, then she can ask the radiologist directly. Alice's GP informs her that she is being referred to hospital to see the cardiologist. The hospital receives the referral, makes Alice's appointment with the cardiologist, and the consultant in charge can see all the scans, reports and messages relating to her care. The cardiologist sees Alice for her appointment and reviews the scans and tests. He diagnoses Alice's condition and her treatment plan to resolve the problem. The GP can see the progress of Alice's case and provide any reassurance or further information to the patient. How Bleeper transforms the patient pathway. It connects the GP to specialists for advice and guidance on diagnostic investigations, sharing responsibility for the patient across all care settings. It creates an auditable end-to-end record of the patient pathway across care settings that is centrally available to all providers. It saves money by eliminating the need for repeat tests and reporting in different care settings. It reduces delays by actively notifying clinicians to updates at each stage of the patient pathway, prompting them to respond and take action. It also drives efficiencies by enabling asynchronous discussion between clinicians in different care settings, which can happen around other clinical work, saving everyone time. Feedback Medical, manufacturer of Bleeper, has a long-standing history of medical imaging and working with clinicians in the NHS to develop solutions that meet their needs. Bleeper is a simple, cost-effective solution that integrates with existing IT systems and is therefore easy to implement.